All right. Hey, welcome to Be Well and Thrive. This is Dr. Bill Rankus with Movement First Physical Therapy. I am joined today by Dr. Morgan Lintz, a chiropractor with Asplund Chiropractic. She just celebrated her first year anniversary there. Previously, before moving to Raleigh, she worked in Des Moines, Iowa on a pain management team, and she is known for the tagline at Raleigh Chiro on Instagram, where she puts out tons of awesome information. Welcome. Thank you for coming on the podcast.
Thanks for having me, Bill. I'm happy to be here.
Absolutely. Absolutely. So usually what I like to do is have people kind of introduce themselves a little bit more and tell us a little bit about what got you into patient care and trying to help people, and what got you into, for you, chiropractic. So why don't you do a little bit about that for me?
Absolutely. So as you said, my name is Dr. Morgan Lintz, and I am a chiropractor, and my main focuses within the profession are pain management and sports performance. And so basically I work with a variety of things from TMJ, shoulder, elbow, wrist, hip, knee, ankle, foot conditions similar to you, Bill, and working on just getting to that root cause, figuring out what is that pain generator. What does the evidence say for this, and what's the best evidence-based treatment we can do to get this person better as quick as we can, truthfully. And not only that, but do it in a way that gives the patient a lot of independence from me as a provider. We don't want to be building dependency to our patients. We want them to be able to walk out our door and know that they have tools in their toolbox to help themselves, that if we want to take a week off, they're not panicking. So that is really my ultimate goal, is to get you to not need me. And I do that proudly. But getting into healthcare, I always knew that's what I wanted to do. I decided when I was about 14 that I did not want to be a vet. I wanted to deal with humans. And so I was looking at things like physician's assistant, physical therapy, orthopedic surgery. Chiropractic was always there because I grew up where chiropractic was founded. So chiropractic is very well known in Davenport, Iowa, believe it or not. And always had it there, but it was a very male-dominated profession at the time, and it was just a big maybe for me. And then my junior year of high school, I had a shoulder injury. I was a pitcher and played collegiately, but the shoulder almost led me down a path of surgery. I wasn't able to play in the most important recruiting season. And the surgeon wanted to operate. I loved my physical therapists. They were amazing. We weren't able to quite get there. And I went to Palmer College of Chiropractic and actually got treated at the school. And I just had a blast being there. I loved everything about, I loved the passion the students shown being a student clinic. I loved how, the doctors really explained what they were doing with me. And it just struck a chord with me. And I, at 16 years old, I never looked back, and went to Palmer, graduated, and now absolutely love what I do.
That's great. That's great. What was it like growing up in the area where chiropractic originated?
Yeah, so the fountainhead is what they call chiropractic. It was interesting. So for a lot of people out there have some sort of opinion on chiropractic. And some use words like, I don't believe in that, or I do believe in that. And I never understood that phrase. Because I'm like, I didn't know it was a belief system. And growing up where it was pretty normal, I saw a chiropractor for the first time in, I believe it was 4th or 5th grade. My dad took me. I cried my eyes out. I hated every second of it. But my dad was actually in a bad cliff diving incident in Hawaii where he swears a chiropractor saved his life. So he kind of exposed me to it early. So it was very normal. I've always been to really awesome chiropractors that truly cared about me and my well-being. And so for me, it just created a normalcy with chiropractic that some people don't have. And so that was something, a hurdle for me was really making sure to properly educate people on, chiropractic, and while there's many avenues of chiropractic, really expressing, the evidence side of chiropractic and what we can do for people has been a big goal of mine.
Yeah, absolutely. I totally understand that sense of having to make sure you educate and let people know what everything that's involved and how it can help. And
Yeah.
what do you find that people do or don't believe in when it comes to chiropractic care?
So chiropractic philosophy is based off a three-legged stool, the science, art, and the philosophy. And it's based off three thoughts that cause dis-ease within the body: thoughts, traumas, and toxins. And so when we think of thoughts, we think of, you're familiar with this, we've had this in our pain neuroscience talks when we first met, but how anxiety can amplify pain, or how your stress, anger, excitement, how that can affect your body. It talks about trauma, like if you are, strain your hamstring, in a soccer game, like that makes sense. A plus B equals C. We have an injury. And then toxins, just environmental toxins, things from your skin and your body, things like that. Some of them, in terms of what chiropractic can do and help with, are evidence-based. Like there is a lot of support now that there wasn't even 10 years ago for spinal manipulation, for headaches, neck pain, low back pain, even ankle manipulations, and people in sports or with verticals, there's stuff to support that as well. But some of these other ideas in terms of healing from the inside out without outside intervention still is not well supported in the literature. And so I think if a chiropractor is very passionate about that and that philosophical viewpoint of helping you baby with the colic, which I've seen. It's an amazing, we don't understand it, but it has, or ear infections, or people who have issues with constipation, maybe it can, but you can't say that there is any validity in that statement. There's a big maybe on it. And so I think there are factors that don't properly express that. And so that creates the, I don't believe that idea.
Gotcha.
Using the evidence, the checks and balances.
Yeah. Almost, I think what I'm hearing you say is that some people are so much in the belief that they're like, this is the truth, this is the gospel, this is what it does. Whereas you're kind of saying is like, yeah, I've seen it, it can do that, but there's not really clear evidence for that. There's evidence for all this other stuff that we do that's great. These things, has happened, but again, when it comes down to what's been researched and what's been proven with the research, it's not as heavily supported.
Absolutely.
Yeah. You keep bringing up evidence. Something that I'm always interested in with healthcare professionals, and that I think patients should be interested in as well, is that, what are you doing to stay on top of your on your field of taking care of patients, making sure that you kind of have the most up-to-date treatment protocols or evidence, or what have you. What are you doing to stay on top of all of that?
So one thing that I use to my advantage right now is clearly, you as well, we're on the younger end within our fields, and some people can use that as, oh gosh, they're really young, I don't know if that's what we want to go to. Or you can look at it as, the average clinician is 10 years behind on latest literature, which is a really upsetting statistic. However, being more fresh out, I am up to date. I came out of school, just about as up to date as you can at this point, in terms of, how well our education did on staying up to date themselves. And on top of that, it really came with the VA, created a passion for evidence that I didn't really have. Reading research papers is not sexy. It's not very fun. And I am so thankful for all the researchers out there, because that, I learned, is not a cup of tea. But I'm a part of what's called a Forward Thinking Chiropractic Alliance group. And it's all evidence-based chiropractors. There's actually even physical therapists within the group. And it really keeps you in check. We share a lot of articles. If you don't have access to an article, you can reach out and someone else may. So it's something that every day I'm reading threads on. Anytime a new paper comes out in our profession, it's on there. There's now Spinal IQ blogs that are blogging on the latest research by the researchers in our profession. So Now more than ever, there's no excuse for us
Right.
to stay up to date. It used to be a lot harder than it is now. So now all it is, making the time for it. And so I try to at least every week, pick a couple topics. And even if I can only skim the abstract that day, always, getting the gears turning.
Yeah, absolutely. That's awesome. What we're going to pivot a little bit and talk a little bit more about patient care. Another thing I like to find out from clinicians is what are some of the things that really excite you about patient care? So, what are the top things that you love about treating patients each day?
So here's one that I hope you can relate to. People are always so quick to say, oh, people aren't going to do the exercises you give them. People aren't going to do things at home. They're too lazy to do that. And I love proving them wrong all the time. If as a provider, you can show them why they're doing it and you can bridge that connection. I have patients coming every day. They're like, oh, I did what you told me to do and I feel so good.
Mm.
And never, I would say, since in the last year of working in private practice, I would say maybe 3 people in a year have said, yeah, I didn't do it. If they hurt and they're no longer contemplating change and they're ready for change, they will do it. And it's your
Mhm.
job just to make that connection. And I love that because they do want to get better. They're not just there for you to rub and push and poke and crack, they want an answer. And so that gets me so excited. My other favorite thing about patient care are the challenging cases. Pain is not sexy. A lot of people don't like working with pain because it's so complex and confusing at times. And I love that. When somebody leaves my office day one, I tell them you're going to feel better, worse, or no different. And then we kind of laugh about it because that's literally all options. And I tell them, I'm like, I've seen this before. You should feel better, but you could come back feeling a whole heck worse. The body is so unpredictable that anyone who claims to know exactly what will happen is kidding themselves and the patient. So I love being real. I love those challenging radiating pains or radiating leg pains, arm pain, or a case that's so simple that you think you're going to have it done in 2 visits and then a curveball comes at you. And it's like, okay, I love being kept on my toes. And I call them advanced puzzles, and I love to solve puzzles. So
Yeah,
those are 2 off the top of my head that that really keep me passionate for what I do.
absolutely. It's interesting you said puzzles because I've had students in the past and or people express interest in physical therapy, and I say, "Do you like solving problems? If not, this isn't for you." Because every single day, every single person, you're solving a problem, you're solving their problem, and you're taking all the pieces that you're given and you're trying to put them together and figure out, okay, how does this work out and how can we get this person progress? So that's really cool that you said that. So what drove you to pain management? You have the experience in the pain management team, and now a couple times you've mentioned that here you like to focus on working with people who are in pain, whether it is chronic pain or just limiting their life. What drove you to kind of get into that realm?
So yeah, so I didn't even realize the passion kind of hit me on the side of the head. What got me to chiropractic was sports and working with athletes. I really, at one time, I wanted to try to work with pro teams. I wanted to work, with high school collegiate athletes, and so that was what drove me in. And as I was going through school, I was like, you know, I would have hated to have been my chiropractor. I love athletes, but sometimes athletes can be hard to work with. And not only that, everybody wants to work with athletes. A lot of people, don't see as much fun in the everyday person. And not a lot of people, but it just anytime you ask me what they want to do, it felt like athletes always came out of people's mind during school. And so that kind of triggered me to think outside the box. And then as I started going through school and as I spent time working with chronic pain at the VA, um, I realized how big of a need there was for that. Chronic pain is hard. You don't just succeed, within the first couple of weeks with every patient like you may with someone who, has an ache from gardening or over the weekend. And so there's so many levels. You have to understand that psychological component. You have to understand the physical component. You have to know what other comorbidities they have going on, whether they're a diabetic, maybe they're on 25 medications and there's a reaction. You really have to dig deeper. And so going back to that puzzle idea is, I grew up doing puzzles. I've done 3 since this quarantine started. I love that. I love having to really use all aspects of our education. And so the complexity of it is really what drove me into pain. I knew that would keep me motivated, keep me excited. It's hard to get bored.
Yeah, absolutely. Absolutely. I totally understand. It's definitely rewarding to help people get that light switch kind of switched and just kind of get them a little bit more in control of their life when it comes to the discomfort they're in. So you talk about comorbidity, and you talk about kind of all the things that can go into pain. And I know from talking to you in the past that you really believe in a healthcare team. What other types of providers or healthcare, people do you strongly believe that each of your clients, or maybe even everybody, should consider just communicating with on a regular basis, whether that's every 6 months, whether that's every month, whether that's every week? What other providers do you like to have on your team, and what other providers do you think people should really incorporate into their lives?
I think everybody's different. And so the vague answer for that is, one, dietitian. I mean, we all can use check-ins with that. I know back in college, I mean, it's just a reality. It's, I met with one back when I was a freshman in college, and that woman seriously changed my life. I mean, even in ways that I speak with patients now are affected from her working with me. And I should probably tell her that. I mean, she was just such an amazing provider. I learned so much about myself. She helped me more than just my diet. We've all done that for others as clinicians, and I really love that. And a psychologist. I mean, you've met Amanda, you interviewed her. I think she is just awesome. I don't know why we still can't get there yet and normalize, psychology and psychologists. And just like, we are, you're a professional and expert in movement and diagnosis. I am in diagnosis, movement. Really, we correlate so much, and we're very similar in a lot of ways. She's a specialist of the mind, in insomnia, anxiety. I mean, who hasn't had anxiety during this lockdown? I mean, how nice would it be that you have a psychologist, like, and trust, that you could have a virtual consult with. I really try to help, because I'm not a psychologist, and I'm sure people have opened up to you about things that you can be a friend and somebody there for them, but at the end of the day, you're not the professional. And making that connection with me, someone that I knew, like, and trust, that I can refer to, is so important. And I really hope that stigma continues to come away, and people know that they can speak to a professional. So those are, in physical therapy, I mean, two things with someone like you, and I'm so happy we met. I could, rave about you for a while, is, we both can diagnose, we both can do that passive modality, and, the active modality component I can do too. The reality is you're able to offer them more time and more breakdown, and you have more of a background. Like, I'm never going to do a knee rehab. I mean, I wouldn't, I don't want to, and I know I'm not the best provider to do that. So having a physical therapist that I know I can trust, I looked for a while to find you, and it's just really, those are the 3 off the top of my head, and there's many more. I mean, you want a good care as well.
Of course.
But yeah, I love the healthcare team.
Yeah, absolutely. Well, thank you. I appreciate that, the glowing review. Absolutely. That's great. What sets you apart from other chiropractors in the area or the field? Not just in how you treat, because I mean, a lot of people do dry needling grafts and spinal manipulation, but when it comes to going the extra distance to make your patients feel cared for.
So taking it, one thing that I've been complimented on from patients is I'm a straight shooter. I think one of the greatest things that we all have to get through in terms of our own personal ego is knowing when to say you don't know, or when to say, like I just said before, that I'm not the right provider for that. If I don't know, or I do not think I'm the right fit for you, I will be the first one to tell you. I'm not going to see you 10 times, then say, hey, we should refer out. No, we should know that in the first 4 to 6 visits if I'm the right provider for you or not. And I have no problem. If someone asks me a question, I'm not going to just pull something out of my backside. Like, I'll tell them, you know what? I don't know, but I know where to find the answer. And I think that's important too, is I have people that I can reach out to. I have things that, I know where to look for the information too. So I love taking that stand. Sometimes it'll surprise them if they ask me a question. I'm like, never heard of that. I don't know, but I'll let you know next visit, and I follow through with that. And so I think that's big. Another big point is I truly, to my core, am very passionate about what I do. Do with passion or not at all has been like my mantra since I was in high school. And when you have passion for what you do, which I know you're very passionate about what you do, you can basically guarantee that they do have your best interest in mind. Because also, if that patient doesn't get better, that's not just them. That there's a part of that that's selfishly about me too. That means that I couldn't help that person, and that's going to keep me up at night. So that passion fuels a higher level of care and commitment to your patients. And I think those are, just 2 important qualities that I'm happy to be able to possess and give.
Yeah, those are good qualities to have for sure. Whenever you're dealing with helping people.
Absolutely.
Yeah. So you said something earlier about how our fields coexist, and I told you I was going to ask this question, but I'd love to get your take on the difference between a physical therapist and a chiropractor, because I always get questions. I have someone on the table and they're saying, what's your thought about chiropractors? Or what's the difference between a PT and a chiropractor? And so I'd love to hear just your thoughts on it and see if you could bring some light to some people with your ideas.
It's a really fun question, and it's also really frustrating because there is a divide in our professions. It's just a reality, not in my world, not in my eyes, but it is. And a lot of it's ego driven. I mean, it's the human flaw and the ego fuel that really drives a large wedge between us. But overall, there isn't as a big difference between the 2 of us. If you look at like an evidence-based forward-thinking chiropractor and a physical therapist, we overlap so much. And so if someone asks me, hey, I just had somebody the other day, she diagnosed herself with IT band syndrome. And you always love that. Google, Dr. Google. And she's like, should I come see you or should I go see a physical therapist? If we both do thorough exams, we come to a diagnosis, and then based off that diagnosis, we know what the best evidence-based treatments are for that. The answer on who they should see can be pretty easy. And sometimes it's either or, right? So I told her, well, why don't you come in, let me do an exam, let me figure out what it is, and then I'll let you know, okay? So, she came in and I found what I found, and I knew, I was like, you know what, here's what I can do for you. I've treated this before. I think we can do it again, and if 4 to 6 visits you're not getting better, we'll reevaluate. Right. And so if she doesn't get better, or, what I gave her for her glute med, isn't enough and she needs more guidance, I'll refer her to a PT. So for me, when it comes to the passive component, there are a lot of physical therapists who can, use grade 5 spinal manipulations now. With the passive component, if you're certified and I'm certified, who do you vibe with better? Maybe they want a female provider. Okay, come here. Okay, maybe they liked you better. Okay, go there. It's maybe their neighbor had great success with you, so they already have the placebo in their head that, oh, he helped my friend, he should be able to help me. Go see him. So when it comes to that passive component, as long as we're equal in terms of our ability to diagnose, it really doesn't matter. From then, I think there is a bigger importance in my ability to refer than maybe yours. I think I'm a great referral partner for a second opinion for you. or someone who maybe needs a cervical manip and that's not your MO. But for me, it's knowing when I hit that wall. Like if someone just had knee surgery, don't come see me for a year. Then I'll work on your, but like that needs to be done by you, or if someone just tore the rotator, anything post-op, definitely PT. Anything, if a chiropractor doesn't do McKenzie or any other sort of rehab, then you shouldn't be seeing a chiropractor. But some of us live in that kind of middle realm that it really just depends. It depends. And if someone says they hate chiropractic, well, then you should go see a PT. It also depends on where their head's at, and what their beliefs are.
Yeah, absolutely. You said it right when you said, when it comes down to if we're looking at, if we're up to date on the evidence, we're essentially doing the same stuff. And that's kind of usually what I tell people. It depends, clinician to clinician, just like it does therapist to therapist as a physical therapist. Someone may be really good with doing a certain technique. Someone might be really good at doing a certain exercise protocol. So you got to make sure that you got the right fit. And asking questions for me is the best. Me asking questions, but also I ask my patients. I always tell them if they're going to see somebody new, a new provider, whether it's a physician, whether it's a chiropractor, just ask questions. Don't be afraid to ask questions, and that way you can make sure you're getting the care that you want and understand the care you're getting.
That's the number one takeaway to take away from our discussion is ask questions. If you are not questioning your provider, you are doing yourself disservice. Every provider is also still a human. And I always tell, like, if someone questions me and they apologize, I'm like, never apologize. You should be
not.
Your life, your money, your body. Question the hell out.
Yeah, absolutely. I don't know about you. I love educating. So that brings out something that I love to do, but also if I don't know, if you don't know, you look it up. Same here. And if it's something that makes you critically think and say, I'm not quite sure, you can explain the best and then again look it up. So definitely ask questions, people, for sure.
Yes.
So we talked about what the difference or similarity is between our professions. What would you change in your fields if you could?
So this is probably what I would change. Is really it's a big issue with our profession, and there could be 10 chiropractors on Six Forks Road, which is where I work, and there probably there's probably like 30 chiropractors on Six Forks.
There's a lot.
And we could all be completely different. That's why that question about PT versus chiro it depends, because there are chiropractors that focus specifically on the upper cervical. There are chiropractors who use only an instrument. There are chiropractors who do full spine extremity adjustments like I do. There is such a wide variety of philosophy approach, whereas PTs, you guys, there's a lot more congruency of care with you guys. There's still differences, but they're more from an outside perspective. You can't just pick them out right away. As with a chiropractor, you can literally walk into an office and be like, this is so different. So I can't ever ask a patient, I ask them, have you ever been to a chiropractor before? They say yes. I can never assume they have any idea about what I'm going to be doing today, because the guy right next door could be a complete 180. And so I really wish there was more congruency across the board. I don't think there's enough regulation within our profession. There's a lot of amazing chiropractors out there. I could refer anybody who asks to a great chiropractor in any state, and even other countries. But there are a lot that are also running a business, and it can make things a little bit complicated. So the philosophy difference across the board, and the fact that we're all small businesses, meaning that, some of them, think about it. If you're running a small business in a time like this and money's tight, maybe, is every decision you're making about your patient, or is some of it about your bank account? And so I wish there was a good answer for that one, but that's kind of tricky.
Yeah, no, I definitely hear you when it comes to regulation. And sometimes in the PT world, it's almost like all there is regulations. But when it comes to congruence, it's interesting you say that, and I hear what you're saying with
Mm-hmm.
the you know, how when you go to a chiropractor, you don't know what the next chiropractor is going to be like.
Right.
Because I actually feel this, I feel very similarly about that with physical therapy. Maybe not to the extent, but I definitely feel like when someone said that they've been to PT before, I almost always ask, okay, well, what did they do for you, to make sure that it was similar to how I treat, and if it isn't, then I would like to explain to them just so they know what to expect. But also, it's interesting because, you know, when it comes to the neuroscience and the pain management realm, you know as well as I do that I almost want to say to each their own, right? To each person is going to react to something different. So maybe it's almost a good thing that there is so much difference, because there are people who will come to my therapy and they won't do good because it's one-on-one, where there will be people who go to a therapy gym where there's 3 or 4 people getting treatment with them, and they'll love that camaraderie and they love that environment. Um, so, you know, it's all kind of in the nature. So it's just interesting that you say that. I totally understand why you would say it. But it's just, it gets me thinking. So that's cool.
I guess
Thanks for
that'd be
bringing that up.
another conversation for us to have is, I know all about the struggles within the chiropractic profession. I know nothing about the struggles within the physical therapy world. And every profession has them.
Mm-hmm.
And I think if you hit a point where you can dissect your profession and you can point out the things that need to improve upon, that's how you know you're heading in the right direction. You're trying to change things, right? You have to look in the mirror and say, here's the weak points in our profession. What are we going to do about it? And I think that says a lot of good stuff for the future. And the Forward Thinking Chiropractic Alliance is doing a lot every day. They just did a huge virtual summit to help improve upon that and create some systems within our profession. So things are going to continue to change and evolve, and it is exciting.
Yeah, absolutely. So we talked about what you would change. What is something that you really like about your about being a chiropractor that you think that some people wouldn't really know that as a chiropractor you do, or you are involved with?
So I guess there's 2 things that pop into my mind, and I probably have like 30 things. But one is, the big reason I chose this actually, chiropractic over, let's say, PT, because I love PT as well. Back when I was making this decision, I didn't know any private practice PTs. I didn't think it was a thing. It was just my bubble. And I love the idea of being able to also be a business owner and being an entrepreneur. I could help people, be a healthcare provider, and own my own business. To me, that was like the coolest thing ever, right? And I'm not there yet. That's my plan. And I love that. I love being able to have an idea in my head and then know that I can create that exact space. And so I love that. I love being able to be an entrepreneur. I just spent all day working on our new software, which you think it would be awful, but today it was really exciting. It was fun, and knowing that, I'm a big part in that transition. The other thing that I love is it's shocking. People don't realize what my patients tell me. There's a lot of times that, if somebody's having a really bad day, or I had a patient the other day whose brother unfortunately just passed, and she let it out, man. I mean, there are a lot of tears that happen. You don't expect it, you don't ask for it. It's, we're putting our hands on people, and there's a connection that comes with that. And they let it out, they let their feelings out. And sometimes I feel like I didn't do a whole lot for them that day, but they come back and they're like, I feel so much better. And a large component of that, I truly believe, is literally someone being there and listening. And I love what I know. I love that they feel comfortable enough to tell me about their personal lives and confide in me with that, and that I can be there for them. It shows that they trust me. It shows that they're comfortable. And I feel honored to help them with whatever burden, is going on. And so while I don't, like I said, that's what psychologists are for. I never cross in. That's not my MO, but just being a friend, I love that. I really, really love that.
Absolutely. That's so great. And I'm really, really happy you said that.
Yeah.
So you mentioned your passion. You mentioned your affinity for puzzles and figuring things out and assessing, and those are maybe your strengths when it comes to your profession. But what would you say is maybe one of your biggest limitations when it comes to helping people?
Biggest limitations. I like that question. That is a good self-reflection. I think one of my biggest limitations in the last year, working when I was at the VA, you could only see somebody every 2 weeks. That's how backed up the schedule was. So it was quite unfortunate. When you're working with someone in chronic pain, in your head, you're thinking more 3 times in week 1, to get an idea, at least twice. I think when I started working with the everyday person, not just veterans with a lot of comorbidities, was understanding what the treatment plan would take. I want to get people in and out. It makes me feel good. It makes them feel good. I want to get them feeling better, right? But it was hard to understand what that would be, and sometimes you start hitting that 8 to 10 visit mark, and in your head, they were going to be moving on to maintenance, and they're still, hitting a rock. And then all of a sudden, maybe visit 16, they're 100%, better. But you're like, wow, I really thought that was going to happen at visit 8. That's always been that's something that has definitely, I think, more and more experience helps you understand a treatment plan better. But also accepting that you'll never actually really know how long it will take somebody. I don't like that. I don't like not knowing. I deal with it confidently, but I wish I could tell you it's, even though it's going to take 6 months, at least I could tell them, hey, on this day you're going to have that. And so there's always that internal struggle of that unknown, but you deal with it.
Definitely. Yeah. It's definitely humbling. And I totally understand that one of the hardest things is when you know so many ways and have had so much experience in helping people, and you want to help them quickly, is just having that patience and saying, okay, this, why isn't it fixing? Why isn't it helping? Okay, well, let's take a look. What's happening? Yes, we're progressing. It's just taking time. Having that patience, and that's definitely something that's hard to learn for sure. I absolutely understand that.
But it's also reevaluate. If you are doing your re-exams or you're tracking your outcome measures, it's not perfect, but at least gives you something objective to show the growth. And in school, like student clinic, I hated all the re-exams and the objective measures. You don't understand it yet. Once you get into private practice, I feel like you start to appreciate it a little bit more. It helps validate what you're doing.
Right. Absolutely. What do you do to keep your body healthy?
So I do quite a bit. I just mind, body, spirit, man. I really have every year tried to really practice what I preach and make myself a priority, because I'm a better friend, family member, clinician when I'm taken care of. And I try and preach that with everybody. But I like to work out. I like to lift weights. A lot of resistance training. However, I am limited to 15-pound dumbbells and a resistance band. I despise running, but I've taken up running. It feels like my own mental toughness work. So I'm up to 25 minutes consecutive running, which is a victory for me. So, but I do a lot of yoga. I'll take my mat outside and just flow, not for exercise, but just to kind of reconnect, open my hips up, breathe, get a little essential oils going, and then even spend some time. One of the best things I got out of COVID was getting back in touch with meditation. And it doesn't have to always be 15 minutes, even a couple minutes of just sitting still, listening to the sounds outside. I've really worked to do that because I think we've all felt an uptake of anxiety and stress with what's going on, whether it's because of your personal life or maybe a family member, or even some of our patients are really struggling. I try and take care of the body, take care of the mind. And then Logan, my significant other, is also a chiropractor, and we are big foodies. So we cook, but we cook very healthy meals. We will ball out sometimes. We did like ahi tuna last night with some brown rice and a spinach salad. And so we do eat really, really well and try and just practice what we preach. So we do. I still, have fun too.
Of course.
Yeah.
That's called living, right?
Perfect. Exactly. And I truly believe in that.
Yeah. What are some things that you are doing or that you can do to support and push health and wellness in the Raleigh community?
This is such a big thing that I want to do and I'm excited to expand upon. Hard to do right now. One thing before this happened, I would have monthly Wine and Wellness Wednesdays. I talked to you about, being at one of those, and I support some finger foods. We have a glass of wine, make it fun. But I do a presentation or I bring somebody else in to do a presentation on a topic that is very relatable. Like we did one on stress and anxiety, and how that can affect your body. We did like little essential oil. People always ask me about essential oils, and truly I don't know a lot about them. They smell good to me. So I have them, but I had someone come in to educate on that. And then everyone got to make their own little thing to take home. We had someone come and we talked about self-care, and not the frou-frou definition of self-care, but what it truly means. Sometimes self-care when you're a parent is maybe showering, like maybe just staying afloat,
I hear that.
Care of. And so we did that and then made a fun face mask. I had Michael Palivo of Your Fitness Solutions. He came and talked on exercises for low back pain. They're really fun. And so I really like, there's of course no cost to attend. We have free giveaways. That's my short-term, smaller way to give back. Now that we have our little healthcare team, and I have a lot of other ideas to help educate and expand and really give to the Raleigh community that I look forward to talking with all you guys about, and making a group effort of those things. So there's a lot more to come there, but they're all in the works.
Very exciting. Very exciting.
Yes.
Yeah. So what else besides your family, friends, and let's say wellness are you very passionate about?
So I'm a huge softball fan.
Okay.
I played for 15 years. I coached privately for 10. I coached high school for 4, ball for 3, and then I'm the volunteer pitching coach for Heritage High School here. Huge passion of mine. I love it dearly. I love talking about it. I love playing it. I love it all. So softball's huge. It's really turned me to who I am. I owe everything to softball. My coaches, my teammates, they've just really turned me into the person I am today. So that's a big one. I'm also like, and sports. I'm just a big sports fan in general. I live for March Madness. It broke my heart. Don't want to talk about it.
Yeah.
I love animals. I told you this, we have a 7-week-old kitty we just got. I grew up with a pet turkey and goats and chickens and dogs who had puppies and cats and a raccoon for a small period. It was like a makeshift farm. That's what happens when you grow up in Iowa. So I do really have a soft spot for animals. I took a break from having any of my own for a while, which was nice, to be honest, but now we have a kitten. And I love being outdoors. We paddleboard. We spend a lot of time on Carr Lake in the summer. I want to get like those little hammocks, portable hammocks you can take. So being outside, if I could truly see every sunset on the water every day, I would do it. That's my retirement plan.
Yeah, That's awesome. That's wonderful. That sounds nice too, especially on a rainy day like today. It sounds real great.
Yeah, this is sad.
Yeah. So I stole two questions that I just love when I've heard them before. So I'm gonna ask you, first we'll just go with, what are three books that you enjoy recommending or giving?
So one that I love is it's Your Body Keeps a Score. Um, it's it wasn't necessarily geared towards clinicians, but clinicians tend to want to read it. But I think everyone should read it. It talks about how the things we go through in our life, how, it affects our body, how it can affect your pain, your brain, your thought process. I mean, it's a fascinating book. It was like I couldn't put it down, and it's written so that anyone can read it. You don't have to have a doctorate or type of degree to read that. And so I really love that. I recommend it to everyone. I also, in terms of what I would give to a healthcare provider, would be World of Hurt, which we've talked about. An amazing book. And then from a personal standpoint, I can't think of one specifically, but what I just read was a gift that I received from a chiropractor. It was Girl Wash Your Face. It's by Rachel Hollis. Really good for someone who's like just starting to go down the road of self-development. If it's kind of new, or you kind of need another kick in the butt to love yourself and push yourself. That was a fun one to read, especially during COVID when you're kind of stuck inside. So
Yeah,
those are the three off the top of my head. Mm-hmm.
that's awesome. Thank you. And then the other question is, if you had a billboard on the side of a busy highway, what would your message to everyone be?
Ooh, that's a fun one. Gosh. I always think of, this is kind of a joke, but I'm in a BNI networking group, and my slogan there happened on accident, but it's "Pain is my jam." They found that was so funny because I love working with pain, but I can just see that on a billboard. But honestly, it would be, I'm a short and sweet kind of person. It would be like a small kid or someone just laughing that's super cute, and it would say "Smile." I was just thinking this the other day. I was walking down the road, and this man looked right at me, or I was driving, he was walking, and just smiled, like biggest smile, and gave me this huge wave. And I was like, why did he do that? Like that was my first thought, is, does he know me? And it was just some nice guy. And I'm still talking about it a week later. And I think we forget how contagious that can be. And so I think something that just you see brings a smile on your face, that can carry you through a whole day. And it's really true. So
Yeah, that's wonderful. I think I would like seeing that on the side of the road too. It'd be a nice
and a
every day.
big little kid laughing, like a happy, like
Right.
1-2-year-old is like the cutest thing in the world.
Yeah.
It's just
Yeah. Yeah. Awesome. Is there any other message, or is there anything else that you'd like to say before we wrap up?
Well, one about me and another big about you. Just to kind of recap, I am a chiropractor. I love working. One thing that I do that I didn't really touch on was extremities. I do a lot of work with TMJ. I love working with TMJ dysfunction. So that's something that a lot of chiropractors don't do. And anything, shoulder, elbow, wrist, ankle, hip, knee, like that stuff is just so fun for me. I love solving it. I look forward to working together more on cases. But mainly what I want to say is I did refer Bill a patient, and he did an amazing job. I have referred to a few PTs in the area, and unfortunately, it was not a good experience for my patient. And that really stinks as a provider, because they trusted you, and then you go and then they just don't treat them the way that they wanted to be treated. And so you took on this client who was, put on a cane with a lot of pain, and we had co-managed her, and she had spent a lot of time with him at that point, and she walked in with her cane but wasn't using it just because she wanted to bring it in just to show her that she wasn't using it anymore. And she was so excited because she wanted to be able to dance at a family member's wedding, and unfortunately got postponed, but she could have. And she was so thrilled. She even lost 6 pounds. Her pants are getting big on her. I mean, this woman, you know, is over the moon about, you know, what you did for her. And so anybody who is thinking about seeing you, you know, is, you know, in the future, if needs to see a physical therapist, I mean, you're hearing from a great one right here. And so thank you for being another passionate, caring, intelligent, hardworking healthcare provider. I mean, we just need 100 more of you, a million more.
Thank you so much for your kind words. I'm very happy that I can be there for you and for all your patients. I'm really happy to be there. Yeah.
Happy to.
Yeah, absolutely. What is the best way if someone wants to get a hold of you to ask you any questions, whether it's about your care, whether it's about something, whether it's about softball, whether it's about TMJ, whatever it is, how can they best reach out to you?
Yeah, so the fastest, easiest way nowadays is just to get on Instagram, look up Raleigh Chiro, Chiro. Follow me and shoot me a message so it'll pop up faster. I mean, follow me anyway, but that is a really easy way. Feel free to shoot me a message. Feel free, if you go there, it can take you to our website. My email is dr.morganlintz, LINTZ@gmail.com. Shoot me an email. Bill knows I'm terrible with texting, so don't even try my cell phone, but I will, you know, I do get notifications from your Facebook page as well. So if someone tags me to post there or shouts out there, I'm happy to converse on that platform as well. So.
Awesome. What about, you know, when it starts up again, Wine and Wellness Wednesdays, is there a link or a sign up page or anything, or like an info newsletter or anything that people could potentially sign up for with that?
So if I get your email, it would go, I would add you to the pool for the newsletters for that. It'll all be on Instagram. We always pump them out on Instagram, and then whoever I'm having, so whenever we do one together, you know, the goal is that you send it out to everyone as well. So
Right.
I'm working, we've had good success, and it was all through word of mouth. I did not do as good as a job at the beginning, you know, with the marketing component, but everyone will get a newsletter via email. So please just message me if you want to be, I'm sending out
Yeah.
newsletters now too. Please do that, and just really Instagram is going to be the best, quickest way.
Great. Thank you.
Mm.
Awesome. So thank you so much for taking the time out of your schedule and spending it with this hour and letting people know a little bit more about you and what makes you unique. I think it was wonderful to hear all the things that make you who you are. Thank you so much. And for everyone out there, I hope you enjoyed, and I hope you're staying healthy and well. For now, hope you are well and thrive.
Thank you, Bill, and thank you to anyone listening. Have a great day.